topic is posterior triangle. Yes. So moving on, firstly it is divided by the inferior belly of homohyoid and it is present behind the sternocleidomastoid muscle. We are already done with the sternocleidomastoid muscle. Now coming to the relations. So now coming to the apex. At the apex we have superior knuckle line where the trapezius and sternocleidomastoid meet. So this is your apex. Posteriorly, there is anterior border of the trapezius. Here, as you can see very well in the diagram. Okay, then anteriorly, there is the posterior border of the sternocleidomastoid muscle. Again, see very properly. Yeah. So now coming to the base. Base is the middle 1/3 of the clavicle, and coming to the roof now. So roof you have to learn this, okay? So for the roof we have investing layer of the deep cervical fascia. On deep cervical fascia there will be an upcoming video, so kindly please stay tuned. Skin, superficial fascia that contains platysma, external jugular vein, branches of the great auricular, transverse cutaneous, supraclavicular and lesser occipital nerves. Okay, and then we have occipital, transverse cervical and suprascapular arteries and lymph vessels. So I'll draw a diagram for the roof for your better understanding, an easy diagram. Let's draw it. Draw it here. We have space here. Okay, so now basically okay, so now for the labeling, let's go on to the black. Okay, so this is your lesser, it is not coming that perfect. Okay, give me 2 minutes. This is your lesser occipital nerve. Okay, this is your great auricular nerve. Okay, this is your external jugular vein. This is anterior cutaneous nerve, and lastly this is the supraclavicular nerve. So this was it. If you have made the diagram with me, then it is easy to understand. And sorry for the messy work, I don't have that much space over here, but in your book draw the diagram neatly, label it neatly, and all the labels to be on the one side of the page. Remember that for good or better marks. Okay, so just remember that till now you have drawn 2 diagrams. Okay, so Yeah, this is your first diagram. This is your first diagram, and this is your second diagram about the roof content. Now coming to the floor. So this is your third diagram. This is your third diagram, okay? So now coming to the floor. The floor is made up of prevertebral layer. So now remember, you get a MCQ on this. That floor is made up of a prevertebral layer. You get a MCQ on this, and you have to remember, I have written this in the other way. Firstly, muscles forming the floor is semispinalis capitis. Okay, then splenius capitis, levator scapulae, and the scalus medius. Okay, so you have to remember the name of these four muscles that form your floor. Okay, and if these diagrams are difficult for you, I'll draw a simple diagram over here. Do I have space? Yes. So about the posterior triangle, let's draw a simple diagram over here. So this is your superior knuckle line. This is your trapezius muscle. This is your trapezius muscle. So posterior and anterior border of the trapezius muscle. This is your sternocleidomastoid muscle. This is your clavicle. And then this is your inferior belly of homohyoid. Okay, so let's just label it now, some different this thing. Okay, so this is what? This is the anterior border of trapezius, and this is the posterior border of sternocleidomastoid, and this is the inferior belly of homohyoid. This is the inferior, just cannot help it right now, inferior belly of homohyoid. Okay, so I hope through this diagram at least you are getting a rough idea about it. Okay, so now moving on, we have come to the content. So first is the inferior belly of homohyoid. It is going to start from the scapula. It is starting from the scapula, and then it goes deep to the sternocleidomastoid in the form of a tendon. Then it is going to continue as a superior belly. See, follow this blue line that I am drawing here. Okay, so see, it is going to start from the scapula, then it is going to go deep to the sternocleidomastoid, and there it is going to be in the form of a tendon over here, and then it is going to come up as the superior belly of the homohyoid. Okay, so we are done with the inferior belly of homohyoid. Next are the nerves. So you should know the mnemonic is ABC: accessory spinal nerve, branchial plexus, cervical plexus, dorsal scapular nerve. Okay, and for the nerve and the arteries, you need to draw one diagram. So you can use this diagram for your reference. Okay, so now coming to the arteries. So we have the third part of the subclavian artery, that is deep to the lower part of the triangle. We have transverse cervical artery, suprascapular artery. Now I tell you here, how will you remember? Always remember it is suprascapular artery, and the other thing is, see here, it is supraclavicular nerve. Supraclavicular nerve. So artery is what? Suprascapular artery, but the nerve is supraclavicular artery. Coming to the occipital artery, Okay, that is near the apex and it is a branch of the external carotid artery. External carotid artery also comes as an FAQ and I'll be making a video upon that too. Coming to the vein, you have the subclavian vein, transverse cervical vein and suprascapular vein. Suprascapular artery and vein present and supraclavicular nerve is present. Now coming to the uplight. Most common swelling in the posterior triangle is due to the enlargement of the supraclavicular lymph node. Commonly they are enlarged in the tuberculosis and Hodgkin's disease. And left supraclavicular lymph node is also called as Virchow's lymph node. Second is the block dissection of the neck for malignant diseases is the removal of the cervical lymph nodes along with the other okay, sorry for that. Moving on, block dissection of the neck for malignant diseases is the removal of the cervical lymph node along with the other structures involved in the growth. This does not endanger the nerves of the posterior triangle. The last applied anatomy is the trunk of the brachial plexus felt in the posterior triangle on deep palpation. So we have the upper trunk and the lower trunk. Upper trunk is the Erb's palsy and lower trunk is the Klump's palsy. I hope everyone has understood. If kindly please like, subscribe and share and stay tuned for the other upcoming videos. And moreover, kindly DM me on Instagram studydent42 if you want the PDF, and even if